Thank you for coming to spend the next hour with us. I am Marta Pirzadeh. I work at FHI 360, and I work with the Advancing Partners and Communities Project, which I'll tell you a little bit about in a minute. I'll be moderating this session. So I'm going to do a quick introduction, and then really I'm going to turn it over to the folks sitting at the table here, and we'll leave about 20 minutes at the end for questions and comments, so please hold those to the end, but we will welcome them and look forward to hopefully a rich discussion about forging partnerships between secular and faith-based organizations. So welcome. And as I said, my name is Marta Pirzadeh. Can you all hear me on this? Yes. Okay, good. Mic's always a little weird. My name is Marta Pirzadeh, and I work for the Advancing Partners and Communities Project, which is a 5-year plus 2-year extension, so now 7-year USAID funded from the Office of Population and Reproductive Health project. It's co-led by 2 large secular organizations, JSI and FHI 360. The project's core focus is on advancing and promoting community-based family planning primarily, but we have many other activities that we're doing outside of family planning, and we have strong provision of integrated healthcare systems and a real focus on reaching those most in need at the last mile of services. And so related to that, much of our work with APC relies on small, large, and medium grants, providing small, large, and medium grants to local and international organizations to implement activities in country. And we have a secondary goal through our grants provision program to also build the capacity of those organizations, particularly those that are smaller or field-based. And so we've given numerous grants to faith-based organizations, and a few of them are represented here, and we're going to talk some about the partnership between this big secular-led project and some of these faith-based organizations, some which are international you'll hear, and then others that are smaller and local organizations. We've also partnered with a few other faith-based organizations that are not here on the table, although they all are represented here, I believe. CCIH, of course, is one of them, ADRA in Nepal, the Salvation Army in Uganda. And, primarily we're working with them to implement activities, whether it's at the global level or in country. And then we provide grants management, oversight, TA, support, things like that. So this panel is really going to look at why we partner with faith-based organizations. I have one slide with words on it. That's it. That's all you're getting from us is one slide. And the rest is pretty pictures and conversation. But, some of the reasons that we partner with faith-based organizations, I'm sure you all know. They're trusted by their communities, particularly in challenging areas and some of these last-mile communities like I was mentioning. Oftentimes, they're able to create and provide community leadership in a way that some, large international organizations just don't have the capacity or the context to do so. We can, through faith-based organizations, access human and financial capital in the form of volunteers and donations that are already established, already, well-informed human and financial capacity within the countries. We know, and of course, that FBOs and faith entities are really the community and cultural anchors in areas where they have been located for years and years and providing services ongoing for many years. They're typically holistic in nature and driven by a higher calling, as you know. And so while many secular organizations are driven by some of the, share some of these same strengths, we really do rely on our partnerships with faith-based organizations to, to reach those communities that they are so well established. So with that, I would like to introduce our panel. And I think you probably recognize and know most of these people, but Dr. Tonny from the Uganda Protestant Medical Bureau, Melanie Lopez from World Vision, and Paul Frank from SIL Lead. And I'll give them each a few minutes to tell you about their organization as well as the partnership that we, have together. And then I will give them a few questions, we'll have a dialogue, and then leave some time for all of you, okay? Thank you. So Dr. Tonny, would you like to start?
Thank you very much, Marta, and colleagues, and you're all welcome. So I work for the Uganda Protestant Medical Bureau, which is a faith-based umbrella organization for Protestant church health facilities in Uganda. And it is owned by the Church of Uganda, other people call it the Anglican Church, and the Seventh-day Adventist Church. So those are the two churches that own the Protestant Medical Bureau, Uganda. And it's been around for over 60 years, having been established initially as a channel for aid from the international world to the clinics. Now, our health facilities are basically established as a result of the communities recognizing the need for the services. And we represent about 40% of the PNFP, or private not-for-profit health facilities in the country, about 45% of the hospitals, and over 60% of the lower-level health facilities. That's the PNFP sector. And until May this year, we now have a university training specifically medical students. So the first medical school under our line just opened in May this year. And I want to applaud the people who have been behind that. People like Doug Fountain have been really working hard for that to happen. And other than that, the project that we have is built from the backdrop of having had a dialogue sponsored by APC about a year or so ago that UPMB hosted, where we had different religious leaders from the different groups, the Muslims, the Anglicans, Catholics, Orthodox, and we dialogued around the issue of family planning. And of course, from that, it was clear that the faith was not against family planning. And as a result of that dialogue, we felt, again, through the partnership that we have, that there was a need for us to integrate family planning within the church health systems, or the church health structures. And we are happy that the APC grant came forth to finance that. And so what we are going to talk about, to basically share with us today, is part of that project, that we have a system of the church which has clergy, or rather where we find a church, and then we have a health facility. And the view was, how can we get into the church structures, bring family planning forth, through training religious leaders, and then these religious leaders reach out into the communities where this health facility is, and then measure the impact of that undertaking in the health facility that is next to the church. So this is really what we've been able to do. We've trained religious leaders, we've talked to different key persons, and we're beginning to see some of that. I just want to allow Marta to just play a video of one of the many religious leaders that we've interacted with.
Sorry, Tony. Didn't mean to interrupt you.
Religion is very important in daily life in Uganda. According to a recent census, 85% of Ugandans identify as Christians, with 39% as Catholic and 32% as Anglican. Religious leaders are respected in their communities and are influential on matters of health and family life. Many faith leaders know the benefits of healthy timing and spacing of pregnancies and how it protects the health of mothers and children, and are willing to share this information with their congregations.
No, family planning is good because God told us to to give birth and feel the world. But it's good to plan, because when you have a big family, then that means the education will not be good, even feeding will be hostile, accommodation will not also be good. You need to have a family which within your means. So we support family planning as a church.
However, not all faith leaders are aware of the benefits and do not yet support family planning. That is why the Uganda Protestant Medical Bureau trains religious leaders on the benefits of family planning and how to talk to their congregations about it.
This video is available on the CCIH website, and rather than take up time to show you the video, when we have live conversation here, I will direct you to the CCIH website to see the rest of it. And go ahead, Paul, if you would like to talk a little bit.
I'm Paul Frank, and I'm the Executive Director of SIL Lead, Lead being Language, Education, and Development. SIL International is an old organization, been around 80 years, mostly involved in community-focused language-related work, minority languages, Bible translation predominantly, but also literacy, and more recently formal education in mother tongue languages. We were a very late addition to this project through Mona, who suggested our involvement, and we facilitated the development of a small booklet on family planning methods based on information from the Georgetown Institute for Reproductive Health, and then the translation of that booklet into the Lusoga and Luganda languages in Uganda. We're using our Bloom software, which has been used extensively in the field of education and mother tongue reading materials development. And this was an excellent opportunity to apply it in the area of health. So that it's easy to use software. That means that people can work in their own language, adapting and utilizing work that has books that have been developed by others with carefully crafted content. So that's been our role in this project, and we are glad to have been included as part of it.
Good morning, everyone. My name is Melanie Lopez, and I'm with World Vision. It was in the program that Susan Ochere was going to be the speaker, so for those of you who are disappointed, I'm sorry.
She's still here.
But
She's
Susan
here in the
is
front row.
here, and she's a reverend colleague and mentor, so appreciate the opportunity to be up here. My role is actually the senior program manager for the APC project through World Vision. So our role through World Vision and APC is we are in a unique setting of a pastoralist community in northeastern Uganda. The population that we work with is about 99% Muslim. So our role is working with faith leaders, imams and sheikhs in that area, both men and women faith leaders in that area to promote and lead in the healthy timing and spacing of pregnancies arena. So while we kind of went in, the grant with World Vision and JSI, we began, I believe, in 2014. So the past 3.5, 4 years, we have been really reaching out to small pastoralist, very rural communities with healthy timing and spacing messages. So we kind of went in talking about family planning and reproductive health, and then got a lot of feedback from our religious leaders that really healthy timing and spacing was the preferred language and message, and so we grasped that and started working in that area. So that is sort of World Vision's role, and also Martha's going to show it's a 5-minute clip. It can be found on YouTube, so we're not going to show the whole 5 minutes, but would encourage you to look for it later, but we'll let the people in Kenya explain it better than myself. Thank you.
Healthy Timing and Pacing of Pregnancies project started in the year 2014. The main objective of the project is to increase access and use of voluntary family planning services within the target areas.
Intervention that targets women and families to make informed decisions about delaying of the first pregnancy and spacing of subsequent pregnancies.
To make this possible, the project collaborates with the Ministry of Health at the national and county level.
The Ministry of Health what is doing is the implementation part of it, whereby we do family planning methods for women of reproductive health, male, and those in need.
In Garbatula, the project is being implemented in Malkadaka, Iresaburu, Sericho, and Modogashe. Community health committees and community health volunteers help in the implementation of the project at the community level.
Tulifanya juu na chini tukishirikiana na wazee wa vijana wenye wanajua kusoma umuhimu wake, na World Vision pia vile litufanyia training, walitupatia na booklets zinaonyesha umuhimu wake.
The success of this project heavily relies on the support of the men in the area.
We begins to teach in this community about the child spacing from the mosque, the schools, or any society gathering. With the health club itself, people are well acquainted with the knowledge of child spacing. Even before they get married, for the last 5 years, the dropout rate has drastically dropped.
The project has made positive impact in communities.
I've realized from even our register.
So as Melanie said, that is also available on YouTube, and rather than show the whole thing, we thought that you would get a taste of it, a preview, if you will. We all love the previews at movies, right? So a little preview, and then hope you'll check it out and get a little more information. But to allow us some time to have a dialogue and some questions, what I would like to do is ask a few questions of our panelists, and then we'll leave some time at the end for you to ask some questions. So, this is for all of you. We often talk about the importance of reaching the last mile, and in many hard-to-reach areas, faith-based organizations are the only ones providing health services. In what ways do you see that as important, and how does your organization or activities go about reaching the last mile, reaching those who are traditionally thought of as hard to reach?
Thank you. As an organization, we do our work within the national framework. And we don't isolate ourselves, or rather we don't work in an island somewhere else. And 80% or thereabout of our network is rural. And it reaches those that actually need these services most. And also, wherever you'll find a health facility, you'll find a church. And it is this church that actually recognizes the need of these communities and then work around establishing these facilities. So for us, we think that through that mechanism, you can reach the lowest person possible with the necessary requirements. Specifically in family planning, we have the lowest level, which is the health center 2. And our view is that through the health center 2, you can do the basic family planning work that you can. Especially that would involve commodities around family planning, but also you can then use the same mechanism or the same facilities and the churches to do outreaches as well, and that's why we are flipping the coin, because previously we were using the facilities as the points of entry. But now we are turning it the other way and saying, can we use the church as the point of entry? And through that, we are beginning to see religious leaders who are coming out openly to say they support family planning. They are able to talk about it in church, and they are able to encourage their congregants to seek family planning services. Yes, as UPMB and other faith organizations, we think that through this mechanism, you can reach the last mile possible. Thank you.
To kind of go off of what Dr. Tonny said, it's the same for our project as well, that we really, our training is we train Muslim faith leaders as well as teachers, and really focusing on the males in that community. In the community that we're working in Garbatula and Isiolo County in Kenya, the men are really sort of seen as the gatekeepers of the community, and so the leadership and the guidance is coming more from males. So we have really championed, sort of male champions, and working with, again, sort of male faith leaders. But it's interesting that the women faith leaders as well, they have asked to now be part of the training as well, to talk to the women that they speak to. But it's been fantastic that that these sort of topics are being talked about in schools and in the mosques and in community dialogue. So as Dr. Tonny said, there might not be a health facility nearby, but there's a mosque nearby, and so they're getting these messages. And with the work of our community health workers, community health volunteers, and the health facilities that are maybe nearest to these mosques, people are seeking services, and through just baseline surveys, finding out that sort of this last mile, there was a significant unmet need that is now sort of being met. So, thank you.
For SIL and SIL Lead, our focus is on minority language communities, and their languages can be a barrier to effective communication. We'd like to see that, though, as a resource, a richness that can be utilized to communicate to people in a language that they understand best, that reaches most deeply into their hearts, and that knits their communities together. There's about 7,000 languages in the world. 6 of those languages account for about 2/3 of the world's population. Another 5,000 languages account for approximately the last third. So there are many, many communities who use their languages actively, and our desire and concern is that, whether that's geographically the last mile or conceptually, that those people be reached. And many development efforts often fail to reach those people effectively because language is not taken into account in a thorough way. So that's where our heart is with those particular communities and the ways that their languages can be utilized for effective communication. We're doing not very much in the field of health and would like to do a lot more. Most of what we've had an opportunity to do has been in the field of education. We've been delighted to have this opportunity to help in Uganda, help reach 2 particular communities with family planning information then by utilizing their own local languages.
So you can see why we, as a large, USAID funded project, really rely on the partnerships with some faith-based organizations to reach some of the communities that might be difficult for us to reach otherwise. And related to that, I would love to hear from any or all of you about your experience collaborating with secular projects and secular organizations, and so we can all learn a little bit about some of the challenges and what you think some of the promises are working within a faith-based organization that is now partnered with secular organizations to get the work done. Sure. And be honest.
As World Vision, we are, one of the largest sort of Christian NGOs, worldwide. So we couldn't do what we do, though, without our secular partners, honestly. We really encourage and seek out those partnerships. A lot of times we even feel like today we sort of have to justify, we do X, Y, and Z. It's interesting as World Vision, people will still come up to me and say, well, you're working with the Muslim community. That's all you're, like that population, or you're working in communities that are not Christian, and you're doing family planning. Like, we did not know that. And so it's really interesting that, World Vision, if we didn't work in communities that weren't Christian, we'd work probably in about 3 countries in the world, as opposed to the 95 that we work in. So we, sort of need those partnerships that are not faith-based, as well as in areas where perhaps you wouldn't stereotypically think of World Vision, such as family planning and reproductive health. So we have always appreciated the partnerships, either directly with USAID or partners like FHI 360, JSI. So it's something that we encourage, and that has helped us also in the communities that maybe might be a little bit skeptical of a Christian organization coming in, but if we're affiliated with maybe a non faith-based organization, it's, I think it kind of goes both ways. Some secular organizations might need the faith-based to get their foot in the door, and vice versa for faith-based organizations. So, thank you.
Coming from the education sector, it is normal for us to work with secular organizations. We have been a small part of large projects in Senegal, Ghana, Ethiopia, Uganda, Madagascar, Afghanistan, Nepal. In each of those places where we've been, some other organizations such as FHI 360, Chemonics International, RTI International have been the prime contractors, and that has given us an opportunity to, we believe, have a large influence through the resources of these large projects. And so when people tell about our involvement, we say, well, we're kind of like a little part of a large project, and that has worked very well for us and given us a way to put our particular expertise into that larger context. And so it's very natural for us to come into this partnership and sure, we're doing work with FHI 360 elsewhere. It's very natural for us. It doesn't feel awkward at all. And we're very grateful for the strength and expertise and professionalism of the large organizations that have given us a chance to become involved in development work in a way that we hadn't been, particularly just a few years ago.
Yeah. This is an area that is always going to be controversial, especially with the faith side of things. I come from a background where I believe that all the money in this world belongs to God, and that it is just possibly in the wrong hands, and we need to bring it to where it's supposed to be. I just come from that, and from that, I believe also that our governments are secular organizations. For example, Uganda, per se, the government is secular, and it's the biggest spender. And we are always asking government to give us money, as the faith. Of course, that comes with its own challenges as well. To me, the way we've worked with the different secular organizations is to make sure that our identity is clear to them. And in such a way that we can also influence the secular organization to look at us with a different eye. Because we tend to lose opportunities because we close ourselves, and we don't want anybody to kind of get to us. It's like you're pushing everybody away. And I think collaboration gives us an opportunity to demonstrate to the outside world that actually we are serving God the way that He wants us to. So, as UPMB, we've collaborated with secular organizations. However, we've put our mark very clear that beyond this we won't go. And we agree on the way the partnership should work, and how resources are supposed to flow. And that's why, for example, in our collaboration with APC, the resources, of course, are coming all the way from AID, but the resources are supporting the church to reach out to the congregants in a way that the church wishes to work. And so I think to me that is an area that we need to really focus on, other than focusing on other areas that actually draw us apart instead of really bringing us to achieving what we're supposed to achieve.
Thank you. Good. Very interesting. I think one of the things when we were planning for this that we talked about in partnerships between faith-based organizations and secular organizations is a lot of times, particularly smaller country-based, faith-based organizations don't have the human capital or the capacity to do M&E, to document their work. And so I'd like to hear from each of you. And increasingly, we keep hearing from donors that they want to see a stronger focus on research and data and increasing the evidence base. And so I'd like to hear from all of you some experiences that you've had as we look to the future, any experiences that you've had related to research and, the importance of rigor within your within your organizational activities, and how that, drives some of your partnerships as well as some of your program outcomes.
Well, again, going back to our experience in the field of education, when we first began getting involved in USAID-funded projects, it was largely because research had been done on the acquisition of reading that showed that children simply weren't learning. Many children get into second grade and couldn't read a word. So it was, as a speaker said this morning, it was data that drove the agenda within the field of education. And so we learned to appreciate data for a variety of reasons, and one of which is it's kind of the currency of doing work within the community. So I remember earlier in our experience of engaging with other organizations, somebody said, well, one of our consultants says, I think we would do it this way. And the person said, well, when we did it our way, we got 300% improvement. What improvement did you get when you did it your way? And we didn't have any data to share. So we have come to appreciate that, and appreciate the fact that people desire to invest, whether they are Christians, governments, whoever, in things that work and can be demonstrated to work. So we've come to value that, and I think it is true. We as an institution don't have a strong framework for doing that. We have very few people that have that type of strength and capacity, and again, that's something that all larger organizations do have that we are weak on.
With World Vision, we typically will do baseline surveys, we'll do midterm assessments, we'll do final evaluations. At times, funding will get cut, unfortunately, and those are sometimes, believe it or not, the first to go, either from advice from our donor or just, again, sort of programmatic. We actually just finished a 3-year study. For those of you who may or may not be familiar with the World Vision's model of channels of hope, it is a model that we use worldwide, really working with faith-based leaders, Christian, Muslim, Buddhist faith leaders, in which it started more in the arena of HIV decades ago, and it has now sort of moved to really just training and working with faith leaders in child and maternal health, family planning, healthy spacing, and timing of pregnancies. HIV is still a huge topic as well, but really training pastors, ministers, imams, sheikhs, spiritual leaders in sort of these topics, and then they in turn pass the message on to their congregates. So we just finished a 3-year operations research on specifically family planning in Kenya and Ghana, where we did a quasi-experimental design of intervention and control communities both in Ghana and in Kenya, in the healthy timing and spacing of pregnancies messaging. So intervention sites received the messaging, the access to family planning services, and then control sites were not. So it's really interesting how, and that was through the Templeton Foundation that we received the funding. So really strong evidence. You can talk to Susan or myself afterwards of how we've been able to do the measurement, how we've been able to sort of get that evidence that these interventions really did work in these communities, and we actually saw some pretty significant change, especially in Kenya. So yes, just to say that World Vision, we really are trying to provide that information and data for having a strong evidence base for what we do to justify working with faith leaders, to justify spreading the messages of HIV or family planning in our communities.
Thank you very much. I think this is a critical issue that we have to embrace as church organizations. In this particular project, it was an area that we had to work around and make sure it is part and parcel of the work that we're going to do. But just to share an experience of how important data is. We've been implementing a project that just ended under the fertility awareness methods. And in the country, those methods were just being captured by the national HMIs, Health Management Information System, as natural family planning. They were not being disaggregated. But through the project, we were able to demonstrate the segregation of the different fertility awareness methods. We captured them in all the health centers that were implementing this project, and were able to demonstrate to the government, we just disseminated that recently, to the government that actually fertility awareness methods work, and that you are able to actually have each of these methods being taken on by different people. And as we speak now, the government is revising, it's now in the final stages of revising the national HMIS to include the different fertility awareness methods nationally. So, and that is coming from our side. So data is really, really important. Unlike in the past where we would keep on saying, oh, you see, we are doing all this, without clearly showing that we're actually making impact. So yes, this is important, and even in this program, we are also trying to capture the impact through data again of these religious leaders. If you have a church and there's a religious leader who is meeting with the congregants, we are trying to capture data in the health facility in terms of referrals by these clergy. And of course, this is a pilot, as I mentioned. We are looking at particular areas. But so that we are able to show that actually when you use the church system, you are able to make impact and cause change.
Can I also just add, Dr. Tonny, it reminded me also not to say that our M&E systems are perfect. There are flaws and there are gaps. We work in collaboration with the Ministry of Health at the sub-county and the county level in our project, our APC project in Kenya, and many of you have probably seen the registers where the community health worker is, writing down what methods people are using, and sometimes that always doesn't get translated into the HMS system, or sometimes, like Dr. Tonny said, the natural family planning, it really isn't one of the options, and so they tick something else, and it ends up being different in the computer systems. But we also work alongside our community health workers and the sub-county Ministry of Health folks to validate that information and to try to make improvements on that. So there will be flaws in the system from the very first check mark that's made with the black ink pen and work its way up, but really trying to find out ways to help improve that at every level.
Great, thank you. So, I have about 15 more questions here in 15 minutes, but I'd really prefer to hear from all of you, any questions that you have for the panel related to their projects, related to partnerships. That would be, I guess Mona will be your microphone. So, yeah, I think right here.
Sure. Yeah, thanks very much. My name's Dave Robinson. I led World Vision's Ebola intervention in Sierra Leone. One of the issues local faith leaders mentioned in terms of working with UNICEF, with World Vision and other donors, the comment was in the capital we wash our hands in the field, in the capital you get to eat. And one of the questions is the resource flow to local faith-based partners who don't feel they're getting the investment in the capacity building that we'll leave behind, their ability to engage and work with other partners for funding as well as M&E and all the full gamut, the full spectrum. So particularly for secular partners, what are the challenges and lessons learned in terms of capacity building for local partners when we use the church or we use the mosque or we use local faith leaders to achieve the objectives of a project, but then they feel abandoned at the end? How do you deal with that challenge?
Do you want to ask a couple questions, Mona, and then we? Okay.
Thank you very much. My name is V. I'm from Zimbabwe. Talking about FBOs and communities, I think we heard from Ambassador Bex that they are focusing on FBOs. But when we went out to look at the FBOs, we were just thinking as Christian, and we have been asked to define what we mean by FBO. So FBO is inclusive, Muslim, Orthodox, you name it. So in terms of community engagement, our entry point has been that we engage all church leaders and traditional leaders as our entry point to communities, which then helps us in terms of identifying the challenges on the ground, and also in terms of how we can enter with the project in the community, where we have no language barriers, because our organizations or our institutions are within communities of different religion, different cultures, and so forth. So that helps us in terms of that. But in terms of service delivery, we realize that we are now being forced, based on the partners, secular partners, whether it's government, international NGOs, to create synergies whereby we don't cause duplication, because when you collect data, we're all gunning for the same person. And we're now being asked to say, can you create those synergies so that we don't have duplication in M&E? And that also helps us in maximizing in terms of resources, which we don't have. So that has actually given us more ground to reach our communities and also target our populations, and then we can have a holistic approach to health and healing. Thank you.
One more, sure. Are you guys taking notes here?
Yes, thank you very much, and wonderful presentation. I'm Peter Yebwa. I'm from the African Christian Health Association platform. They're coming together for the Christian faith base in Africa, ACHAP. One of the challenges cited by governments and other partners in dealing with faith-based, Christian faith-based, is this part of fragmentation under the guise of unity in diversity. And from the presentation so far, I was trying to see, is there any clearinghouse that harmonizes all these, synergies to one? So how do we harness in the united form all the synergies or the competencies in one form so that it will help us with our advocacy, our resource mobilization, and the rest, so that partners are not confused, governments do not take advantage of our splinter form in dividing us, and so that we can also forge a united front as united Christians. It is a challenge. How do you address that in a practical way? I heard of data collection and the rest, so government do not even know the extent of faith-based contribution in our health system. They can talk of UPMB, they can talk of this. How do we promote unity in diversity in the way that it means our advantage? Thanks.
Thank you for the questions and comments. I'll try to kind of touch on all of those. The capacity building for local leaders so they don't feel abandoned, that's something that World Vision really does strive to do as far as building capacity in the communities. We realize that our grant will eventually end, and it will end sooner than we wish, and that's one of the things that we really get a lot of positive feedback from our community leaders and faith-based leaders is that, thank you for this training, because whether or not you're there, we can still say the same things to our congregates. We can, we've been trained. There's, 80 of us in our community. We are still, going to preach this message, and teachers as well. So It's something that you have to be intentional about, but that sort of community capacity building. The second comment with the faith-based organizations and communities with different religions and cultures, and the M&E and not duplicating. It's something that also has to be really intentional. I think things like partner mapping is very important. If you're going into a community, who's there, who's already doing what, who can you kind of help fill in the gaps and vice versa. So just knowing who's there in that community, likely you're not the only ones there. So how can you sort of leverage and communicate those sort of synergies, which kind of leads into the third question of the fragmentation and the clearinghouse to sort of harness unity and advocacy. That is something that I'm extremely passionate about. Health is my background, but just sort of that advocacy piece of, I asked a question in the first session about sort of that, how do we as the church, how do we as faith-based organizations, how do we as secular organizations really advocate and mobilize as a unified church, as a unified voice in some of these major issues? And I think if not now if the time is not now, I don't know when it is, when we really as CCIH, as faith-based organizations, as again sort of the church, now is the time to speak and the time to unify globally within the United States. There's so much that we can do, and World Vision does have a very sort of powerful advocacy arm to it as well. So I love hearing those requests and things like that.
Thank you very much. I think for me, the way I would look at it is that we have been there as the faith organizations. We've had so many projects, they come in, do parallel things. But from the work that we've seen, and also from our experience, is that my religious leaders are more likely to listen to me than to listen to somebody else, telling them about whatever. Okay? Even if you have money, you'll come in, you'll do whatever, you train them, but they will always go back and say, what are these people up to? Okay? And eventually, things tend to go the other side. But the experience that we've seen is that if you work with existing technical teams, across the continuum of care, the religious leaders are likely to be more responsive, and they're likely to sustain the capacity building undertakings that we put in place. I think the other issue that I wanted to mention is that when you see, for example, what has happened in Uganda, just by UPMB getting deep into family planning and demonstrating our work, we were able to bring on board our colleagues, the Catholic Medical Bureau, to cause them to send the message of what they believe in terms of family planning. And they came out strongly to support fertility awareness methods, and because that's what they believe in. And so we've worked together, and something that is changing in the country. 2 weeks ago, we had a situation where USAID has been financing the commodity supply under the alternate distribution system, which is basically the private and the PNFP through another supply chain arm and not our supply chain arm. But because of the work that we've done together and demonstrating that you can, if I don't eat something, give me what I eat and let somebody else eat something else. But all of us are eating, okay? And now USAID has just all of a sudden, because there were issues with that supply chain component, and over $30 million are now moving to our supply chain arm, okay, for commodities. A complete shift of things, because there were always notions that these guys are against family planning, so you can't give them resources. But we've come out to show that actually we're not against family planning. I think that has been the biggest challenge with us as faith, that we've not come out to show and demonstrate what we believe in, so that people can look at us that way, and because we kind of hide behind the curtain. And that always reminds me that if you are not on the table, you will become the menu. You know? Guys will just sit and consume you while you're not there. So we must get on the table and know what is happening. Mwai earlier just told us what is happening under the PHC component, that faith is completely out. So you want to ask yourself, how did faith get out? Isn't it because of us, the faith people, that we went out? So I strongly believe that for us in Uganda, we are pushing our foot in, that even when your hands are out and your eyes are out, make sure your nose is inside there, and that you're smelling the food that is cooking. Otherwise, I think to me that's the way I want to look at it from the question that Peter asked. And so yes, UPMB, UCMB formed joint medical stores, and we are now going to start. Joint medical stores has been accredited by USAID to supply family planning commodities in Uganda for all of us, as a sector. And it's because of what we've been able to demonstrate. So people will always change around things. And the reason is the Catholics will have their natural family fertility awareness methods commodities, which are the psychobids, while UPMB that consumes all the others will have our own commodities. So to me, that is a positive side of things. And I encourage all of us to come out and preach the message of what we believe in so that everybody can actually understand.
Any thoughts? Okay. I wanted to just respond to the first question, too. As I mentioned when I was doing my brief introduction, a large part of the APC project is providing these small, medium, and large grants to both local and international organizations. But in addition to providing the grants, the secondary goal of this project, and a huge part of the project, is to build organizational capacity of these, these organizations, so that when we do leave after 5 years, 7 years, that they have a stronger understanding of if it's the M&E systems, or that they've learned how to work with USAID so they can move forward on their own and things like that. So our project director's here, and I'm sure she could tell you all about the grants management side of it, because I don't really work on that side. What are you going to say? Yeah.
Also, hi, my name is Pirzadeh with APC. Also with our grants and some. Under our project, we have a portfolio of about more than 100 grants that we give in a variety of areas, including in our core funded work and family planning. And in some instances, when we give a grant, the person, the entity receiving the grant, can then make a decision to sub-grant to smaller local organizations. And we have that example in Guyana, in the Dominican Republic, and in some of our post-Ebola work in West Africa, for instance. So I think to the question of how do you get to the truly local group, that is certainly one vehicle that we've used quite a bit in our grants portfolio.
And that's how we came to UPMB. We had given CCIH a grant for several years, and they sub-granted to UPMB. And then this year, UPMB is receiving their own APC grant. So, it has been an evolving process.
We have 2 questions over here.
Okay, great.
Thank you very much for the presentation. Mine is not really a question, but just a comment. Everybody has mentioned how it's very nice to go into partnership, and it is, and we can't scale up without partnership, whether it's secular or international, FBOs. But there are challenges, and real challenges, which we're not bringing them out here. The challenges are that when international organizations come to our countries, it is implied or assumed there is no capacity. And really, it is insulting. There's been capacity for over 100 years in FBOs in our countries. And the other implication is that when they come, when grants are announced, they want to get you on the table. You will be on the table. They'll get your data and how you've been working And once a grant, and you'll be a sub-recipient, assumed you'll be a sub-recipient in the grant. When the grants are announced and awarded, there's no more transparency. In fact, we have had experience sometimes they want to kick you out. They have used you, and they want to kick you out because they assume you have no capacity. And they want to reinvent the wheel. So they'll be doing things that you did 20 years ago. And some things didn't work. And you're trying to talk and go back on the table. Nobody wants to listen anymore because in the beginning, you've just been used for that award, for that proposal. So you keep fighting, and these are real issues. So how do we get our partners to recognize that there's been capacity at the local level, and how can they tap in that capacity? And even when they include you in the proposal, how do they make sure, or how do you make sure that you're actually part of the cake? Because after all, we're all serving the same people. These are real challenges, and we need to be addressing. So the take-home message is that partners, whether secular or international FBOs, we need to recognize that there's capacity.
So I just wanted to bring up the fact hi, I'm Katie. I come from the Evangelical Lutheran Church in America. So we primarily work with other churches in the world as they're doing diaconal work, development work themselves. So one of the big questions that constantly comes to mind, all of us talk about working through faith leaders, and a lot of these faith leaders aren't making enough money to support themselves, and then we're putting additional request of their time, of their energy, and so I'm not against it. I think it's been very effective, but what are we also doing to make sure that they're able to do this work? Because from the church perspective, a lot of these churches can't provide the salaries to the pastors, and so they're, in addition to being a pastor, in addition to doing the things that they've been trained on, they're also doing their own farm, they're doing their own thing, they have to participate just to be able to make ends meet too.
Yeah, thank you very much for those comments. I agree with you entirely with the comments that you've made. But I also want to believe that we have to start somewhere. We have to, at some point, put our foot down, especially looking to where we've come from. We also want to believe that we are not at the same level in terms of capacity. Some of our organizations actually lack the capacity. I appreciate, for example, CHAS has built a significant capacity to where they are today. When you come to Uganda, UPMB has done that. But also to a certain level, we are not there. Okay, no? At that point where you can comfortably say yes. We also have other organizations that are also struggling. And so I want to believe that, with international work, we have to demonstrate documented capacity. And I think that's where we've had significant challenges. There are certain standards that funders want to see. Even I remember we had a grant of about $5,000, but you see a team that is coming to assess you, and the money they have just spent to come and assess you for the $5,000, is just about maybe $20,000. So these are some of the things. But a decision that we took at UPMB is that we will subject ourselves, to these tests. And because we believe that after that, then they will eventually come to understand that we meet those standards. We just UPMB was just received an award, a corporate governance leadership award, as the best NGO in Uganda just in May. And it's because we subjected ourselves to competing, and showing the country and the world about this. So actually, we were shocked that many of these big NGOs, we beat in terms of, they were looking at different issues. But we were the forefront of many, Compassion International, I don't know, all these. So sometimes you think, as Karen is saying, sometimes you think that you're not there. But, and it's because we don't subject ourselves to international standards of being assessed. We keep ourselves the other side. And I think that is the missing link, that we must really come out, allow people to come and audit our systems, because that's the way the world is moving. We can no longer depend on faith, because we know bishops have messed up big time. We know reverends have messed up big time. So we must come out and allow the world to scrutinize us. So that is not about trust, but it's about transparency, it's about systems. And I want to believe that that's how we are going to really reach out. Thank you.
60 seconds.
That's okay.
60 seconds, I promise. Just to the last question, the faith-based leaders in their time, the same can be said about teachers. They also get underpaid and overworked. So we do recognize that. That said, your teachers, your priests, your pastors, your imams, they really are the leaders in the community. People look up to them. People, look to them for guidance on life and on education, and as part of raising families and children. If and when, at least for our specific grants, there are stipends. There's, they're given, per diems for their day and for their time. Do we have the capacity to pay them to give our messages? Not always. The same with teachers. A lot of times it really is sort of relying on the kindness of people's own hearts and volunteering that time. We do have a lot of people, teachers and religious leaders, that do volunteer for this, and a lot of those that decline also because they just don't have the time or the bandwidth to do that. So it is a lot of times on a voluntary basis. They might receive stipends or per diems for the training and that sort of thing. And recognition, we've also been able to recognize and sort of award with certificates or recognition or champions that they get to be then trainers to train other religious leaders. And that sort of status is highly looked upon as well. So it kind of motivates them to also then engage other, faith leaders. But it's something that, with our community health volunteers, with teachers, with priests, a lot of these things are just on a voluntary basis, and we really try to find innovative ways to motivate and to recognize and to appreciate those that work with us. So thank you.
Thanks. I want to thank you all for coming to the session. We really just scratched the surface. You can see there are many challenges as well as benefits to these type of partnerships, and really it does come down to the dialogue and the communication and understanding each other. So hopefully we can continue that, and thank you all for joining us.